It's Wednesday, October 2nd, and this is the Daily Medical News, where we bring you the day's top clinical medicine headlines, as well as an in-depth look at the day's biggest story. I'm Nick Andrews.
And I'm Molly Collegio. Today, new guidelines may complicate the message you give to patients about eating red meat.
What kicking cannabis does for cognition in patients with multiple sclerosis.
A tyrosine kinase inhibitor shows benefits in fibrosing interstitial disease.
And apple cider vinegar falls short as atopic dermatitis treatment.
Plus, medical boards are changing how they ask about doctors' mental health history.
People who eat red meat or processed meat should continue their current meat consumption. That's the surprising message from the guidelines by an international panel that analyzed the health effects of red meat and processed meat consumption in systematic reviews and meta-analyses. The guidelines appear in the Annals of Internal Medicine. The panel found that low to very low certainty evidence that diets lower in unprocessed red meat may have little or no effect on the risk of major cardiometabolic outcomes and cancer mortality and incidence. What's more, meta-analysis results from 23 cohort studies provided low to very low certainty evidence that decreasing unprocessed red meat intake may result in a very small reduction in the risk of major cardiovascular outcomes and type 2 diabetes. And there were no significant differences in all-cause mortality and cardiovascular mortality. The new guidelines for red meat and processed meat consumption will be controversial, note Dr. Aaron Carroll and Dr. Tiffany Doherty in a related editorial. But they are based on a review of all available data on red meat and processed meat consumption. And Dr. Carroll and Dr. Doherty say it will be difficult to find evidence to argue against them.
There's good news about cognitive impairment for patients with multiple sclerosis who have been using cannabis heavily for symptom relief. Their memory, executive function, and information processing speed will improve significantly once they've been off the drug for just 28 days. That's according to a randomized trial presented at the annual Congress of the European Committee for Treatment and Research in Multiple Sclerosis. The study included 40 MS patients with global impairment of cognition who had started using cannabis for MS symptoms relief 2 to 3 years after receiving their diagnosis. Half were randomized to quit using cannabis, while the others stayed the course. By day 28, the abstinence group performed significantly better on their neuropsychological test battery than at baseline. The patients who kept using cannabis showed no such improvements. But the study's University of Toronto researchers found a surprise twist. Despite the cognitive improvements, the patients who quit would rather be using cannabis to treat their pain than to have their memory intact.
In patients with fibrosing lung diseases other than idiopathic pulmonary fibrosis, the tyrosine kinase inhibitor Nintedanib substantially reduced the rate of lung function decline. That's the key finding from a Phase 3 INBUILD trial presented at the annual Congress of the European Respiratory Society. Nintedanib inhibits intracellular growth factors implicated in fibrosis, and it's already indicated for idiopathic pulmonary fibrosis. Researchers at National Jewish Health in Denver randomly assigned 663 patients to Nintedanib or to placebo. Those in the Nintedanib arm lost lung function at a rate that was less than half of those randomized to placebo. While the rates of death were numerically lower at 52 weeks in the Nintedanib group, the difference was not statistically significant. We'll be right back with more medical news after this message.
Acetic acid, particularly apple cider vinegar, is a prominent option on the list of emerging natural remedies patients use to treat atopic dermatitis. But applying diluted apple cider vinegar had no long-term effects on the skin of patients with AD. Researchers at the University of Virginia in Charlottesville compared 11 patients ages 12 years and older with mild to moderate AD with 11 healthy control patients. For 14 days, study participants soaked one forearm in dilute apple cider vinegar, equal to 0.5% acetic acid, and the other in tap water for 10 minutes daily. The researchers measured changes in pH and transepidermal water loss. Transepidermal water loss rose significantly immediately after treatment in both groups, then fell back to baseline at 30 minutes in AD patients and at 60 minutes among controls. There was a transient drop in skin pH lasting 15 minutes in AD patients and 60 minutes in controls. The verdict? The researchers say their study shows that acidification by topical bathing in an apple cider vinegar solution isn't useful to treat atopic dermatitis.
How far should state medical boards go when delving into doctors' mental health histories in licensing applications? That's a question many boards are pondering, and those in Florida and elsewhere are assessing whether the phrasing of mental health-related questions poses an unintended hurdle for doctors who need help for such conditions as depression. The Federation of State Medical Boards recommends limiting such queries, if they must be asked, to questions about potential current impairment. But the Florida license application takes a more sweeping approach that may discourage physicians from seeking treatment. That's according to Dr. Delicia Haynes, founder and CEO of Family First Health Center in Daytona Beach, Florida. Dr. Haynes recently posted a video on YouTube discussing her own experience with having been treated for depression and then needing to report that to the state board. Dr. Haynes says state medical boards play a critical role in protecting people from physicians whose current mental health conditions may risk harming patients, but they must balance that against the consequences of overly intrusive questioning. Efforts by the Federation of State Medical Boards have spurred a wave of reconsideration of these kinds of questions. The Federation offered specific advice to state boards about licensing application questions as part of recommendations to address physician wellness and physician burnout. California, Colorado, Florida, Georgia, Massachusetts, Minnesota, Mississippi, and Oklahoma have taken steps recently to reconsider the phrasing of mental health questions. Nevertheless, doctors in most states still face questions about their mental health that are beyond the limits of standards set by the Americans with Disabilities Act. A recent review found that 32 licensing boards ask questions beyond the limits of ADA standards. And that's it for today's Daily Medical News. Remember to look for the latest edition of the SiteCast by MD Edge. New episodes of the SiteCast are available every Wednesday. For MD Edge, I'm Nick Andrews.
And I'm Molly Collegio. Thanks for listening.